Alpha Adrenergic Agonists, the game changer in BP and eyes. All right, my future nurses and docs. Today we're diving into Alpha Adrenergic Agonists. If you've ever wondered how your body responds to stress, blood pressure changes, or even pupil dilation, you're in for a treat. These meds have some wild effects, and trust me, I've got a fun memory trick that will make this stick forever. So grab your notes and let's get into it. What are alpha adrenergic agonists? All right, picture this. You're in the middle of the woods and suddenly a bear jumps out at you. What happens? Your body goes into fight or flight mode, your blood vessels tighten up, your pupils dilate, and your body preps for action. That's exactly what alpha adrenergic agonists do. They mimic adrenaline and get your body ready. Alpha adrenergic agonists boost the fight or flight response. But instead of running from bears, we use these meds to control blood pressure, treat shock, or even help with glaucoma. Let's break it down. Here's the best way to never forget alpha adrenergic agonists. Just remember, alpha, alert, and activated. Alpha adrenergic agonists get things going. Raises blood pressure. Vasoconstriction finds tighter arteries. Dilates pupils, eyes open wide like when you see that bear. Decreases secretions, less saliva and mucus. Slows GI motility, digestion slows down. So when you think of alpha, think of your body getting alert and ready. All right, let's talk about the biggest players in the alpha agonist world. Prototype drug, phenylephrine, neosynephrine. Our prototype drug is phenylephrine. This is the nasal spray or IV med that shrinks blood vessels. That's why it's used for stuffy noses and low blood pressure. Phenylephrine tightens vessels and clears nose. Other alpha agonists you need to know. Clonidine, catapres, lowers BP, used for hypertension. Midodrine, raises BP, used for orthostatic hypotension. Brimonidine, for glaucoma, reduces eye pressure. So, depending on the drug, alpha agonists can be used for high BP, low BP, nasal congestion, or even eye pressure. All right, we love these meds, but they come with some side effects, and trust me, these are big ones to remember. Common side effects: high blood pressure because vessels tighten, headache and anxiety. Your body thinks it's in fight or flight mode. Dry mouth and constipation, secretions slow down. Fast heart rate, palpitation. Biggest thing, hypertension crisis. If a patient takes too much clonidine or midodrine, their BP can go way too high, which is a medical emergency. Nursing alert. Monitor BP closely. Who should not take alpha agonists? Contraindications. Okay, not everyone can take alpha agonists. Here's who should avoid them. Contraindications. Severe hypertension. If BP is already high, we don't want it higher. Heart disease can make palpitations worse. Glaucoma for some types. Pupil dilation can increase eye pressure. Hyperthyroidism can worsen symptoms. And for patients with glaucoma, be careful. Some alpha agonists can help, but others can make it worse. What foods and meds to avoid? Major drug interactions. Avoid these while taking alpha agonists. Beta blockers opposes the effects of alpha agonists. MAOIs can cause hypertensive crisis. If a patient is on alpha agonists, tell them no caffeine, no alcohol, and no MAOIs. Overdose? Here's the antidote. Phentolamine causes alpha blocker, reversal agent. If a patient overdoses on an alpha agonist and their BP skyrockets, we give phentolamine, which blocks those alpha receptors and relaxes the vessels. We also give IV fluids and beta blockers if needed to stabilize BP. Nursing considerations, what you need to watch for. All right, nurses, here's what we're watching out for. Nursing alerts. And one more tip, clonidine withdrawal can be dangerous. If patients stop suddenly, their BP can spike dangerously high, so they must taper off slowly. Boom! You just mastered alpha adrenergic agonists in under 10 minutes. Now you know the memory trick, types, side effects, interactions, and nursing care. If this helped, don't forget to like and subscribe for more easy med breakdowns. See you next time.